innovation is actually twofold. It has to do with both the content of what we deliver and the actual delivery method. Physician assistants are a new healthcare profession in Ontario, so our curriculum is actually based on undergraduate medical education. We're housed within the Department of Family and Community Medicine. We deliver a 24-month curriculum where the year 1 is actually mostly academic courses and year 2 is actually a blend of coursework as well as clinical placements. The real innovation is in our delivery method. The curriculum is actually a blended distance model where the whole program is actually online, not just one course. We actually estimate at least 60% of the material is delivered online. The entire program was actually delivered and supported by the Consortium of PA Education, which is an amazing collaboration of both the University of Toronto's Faculty of Medicine, the Northern Ontario School of Medicine, and the Michener Institute for Applied Health Sciences.
So as a physician assistant in Ontario, I'm proud to say that our profession is growing as a response to the health human resource needs of our province. The Ministry of Health, with their strategy of Health Force Ontario, initiated PA education in Ontario, and this is a strategy of the ministry to help meet those human resource needs. Our curriculum program is designed specifically to meet the mission and vision of our program, which is to support our learners across Ontario to live at home during their training and then hopefully serve their home communities upon graduation. Our graduates are prepared to work in rural, remote, and underserved communities, which is where they're needed most.
The creative process actually involves the delivery of the program. We actually start within the learning management system at the University of Toronto, known as Blackboard, and we move on from there. We consider the tools that are best utilized by students in ways that they can actually interact with both each other, the material, and the instructor. This is the best way to promote learner engagement and deliver a successful program. The way we actually implement some tools so that students can engage with each other, we first of all use a lot of group work, both asynchronous and synchronous group activities. We use both discussion boards and blogs so that students can really interact with each other. As well, students actually always meet at a virtual hallway known as Skype or Facebook. You might have heard of them. And this is a great way for them to interact when they may not be actually physically present. They actually interact with the material both online and face-to-face. We're constantly thinking about what is the best method to actually deliver this content. If it isn't something that is best suited face-to-face, we can actually deliver it online. One of the examples actually has to do with EKG interpretations. Students do an entire online module and then they actually come face-to-face and do a hands-on practice where they actually physically get to practice how to actually do this important skill. Students are actually always engaged with the instructors directly. They're asynchronously available online, as well as actually we have set meeting times, office hours, and seminars. One example is actually the delivery of electronic PBL, known as EPBL, a big favorite for our students. We're always looking for new and interactive technologies that will be the most effective and the least expensive to supplement Blackboard and other standard tools.
We train mid-level healthcare providers in a relatively short period of time, and we challenge the notion that all medical education should be delivered within the four walls of an institution. Our program has already achieved a number of successes. We received our accreditation in 2011. Our first cohort of graduates passed the national certification exam, and all of them have been employed as physician assistants across Ontario. Almost half of them work in their home communities, and about a third of them have reported that they were influenced by their clinical education to look for work in rural, remote, and underserved communities. So I think our big impact is that we deliver online medical education to fulfill our social accountability mission, which is to train the future generation of healthcare providers to meet the needs of Ontario and especially the needs of underserved communities.